Flu cases are climbing across the country, and health experts warn this season is shaping up to be worse than normal. Doctors say a fast-spreading strain is driving more ER visits, and there's a reason parents in particular should be concerned.
Yeah, scary stuff this year. Savannah Welch is joining us. What we need to know. She spoke to doctors. What are they saying about this year?
Well, this year, cases are really quickly picking up, and health experts warn that emergency room visits for flu-like symptoms, they say they've doubled in King County in the past few weeks. We looked at the data and found a majority of people showing up at the ER are kids. The county is still at what's considered the moderate level, but data from past seasons show an even bigger spike could be coming.
We're seeing emergency department visits for flu. We're seeing hospitalizations for flu. We've had 10 deaths so far in King County due to flu, all in adults.
In King County, emergency room visits for flu-like symptoms have jumped from about 300 visits a week in early December to more than 560 in early January. The dominant strain this year is influenza A H3N2, a type of flu that mutates quickly and spreads easily. This season's flu vaccine wasn't designed to fight what's become the dominant strain. However, the shot is still the best protection you can get to prevent severe illnesses.
It still does what it's supposed to do, which is help keep you out of the hospital. Is it perfect at doing that? It is not perfect, but no flu vaccine ever is. It reduces the risk of ending up in the hospital by about 40 to 50%, especially if you're medically higher risk.
Public health leaders stress the flu can be serious, even for otherwise healthy people, and they say children remain a major concern.
Last year was a particularly severe flu season, and in fact, we had the highest number of national pediatric deaths since CDC started tracking pediatric deaths in 2004. There were 289 kids who died from flu, and 89% of those were not fully vaccinated.
Health officials say that if you wake up with a high fever, body aches, or a cough, get tested. They urge people to stay home if sick, consider masking in crowded spaces, and get vaccinated, especially those at higher risk.
Right now, just over 31% of King County residents have received a flu shot. Now, that's lower than this time last year. For people looking to get a flu shot, free options are available. We posted a link on our website, king5.com.
Yeah, King County also usually the higher end when it comes to vaccinations. What can you tell us about flu in other surrounding counties?
It's a very similar story. So for Pierce County, the transmission rates and ER visits are a little bit below this time last year, what we saw, but still high enough to reach that transmission threshold alert for the county. And then Snohomish County cases are still also moderate like King County, but they're continuing to climb. So public health officials are keeping an eye on those numbers and really trying to encourage people to get their vaccine and keep those numbers up, because they have seen a decline in vaccination rates over the last 4 or 5 years.
Yeah, and the vaccine will prevent not just the flu in a lot of cases, but also severe illness, which is a big part of it, right? So,
yes.
All right, thanks, Savannah.